Now we're going to go over some of these sutures, guys. You do need to remember your sutures. First one we're going to talk about is the coronal suture. It goes from left to right across the entire skull. And that coronal suture is connecting the frontal bone to both of those parietal bones right here. Then we have the sagittal suture, which goes right down the center of the head. The sagittal suture along the entirety of those parietal bones. That sagittal suture connects both of the parietal bones, left and right. On the back here, we have the lambdoidal suture. The lambdoidal suture connects the occipital bone to both parietal bones, right along here. That's your lambdoidal suture. And finally, the main one I want you to know, guys, or not just the main one, but one of the other main ones I want you to know is your squamosal suture. Easy way to remember the squamosal suture, guys, it's right next to that squamosal portion of the temporal bone. The squamosal suture is going to connect the temporal bone to the adjacent parietal bone. Squamosal suture is located on the other side as well. Temporal bone connected to the parietal bone. Squamosal suture. So squamosal, lambdoidal, sagittal, and coronal. Now we also have what's called the junction points. A few major ones I want you to know, guys. The first one is called the bregma. Bregma is the junction point between the sagittal suture and the coronal suture where they meet and come to a point right here. That is your bregma. If I turn the head the other way, we have the lambda junction point. And the lambda junction point is where that sagittal suture meets the lambdoidal suture. Lambda. Lambda. Easy way to remember that, guys. Lambdoidal suture, lambda junction point. They have very similar names. If I turn the head this way, we have the pterion junction point. The pterion is right here. The pterion is where that squamosal suture meets the coronal suture. That is your pterion. And there's a left and a right pterion because you have one on each side. If I turn the head back a little bit, we have one more called the asterion. There's a left and right asterion as well. The asterion is where the suture, the squamosal suture, meets the lambdoidal suture right here. This is the asterion. And that would be your major junction points. Now let's start going through some of our facial bones. Not as much landmarks, but obviously more facial bones in total. So starting from the top here, guys, we have our left and right nasal. We have our left and right lacrimal, which is this orange area right here. One way you can remember that, if you remember, guys, is that's where your tear ducts are located. Lacrimal also stands for tear duct. We have the left and right zygoma, also known as the zygomatic bone, also known as the malar. That's where your cheekbones are formed. You can feel that on your own face. That's the left and right zygoma, zygomatic bone, or malar. You can use all those terminology for that same bone. Moving down, we have our left and right inferior nasal conchae, which you can actually not see very well through this model. But if you're looking straight through there, as those little curvy ribbon-like bones, they're called the left and right inferior nasal conchae. Not viewable on X-ray, only on CTs and MRIs, but just make sure you know that they're in there. And they're going to be located below the ethmoid bone. If we look a little closely, we can also see the vomer through there. It's a tiny bone right above the hard palate and the palatine bones, the vomer. Looking straight on the purple portion, we have our left and right maxilla. Left and right maxilla. And then it's not connected to this skull. We're missing the mandible. That would be another one of our facial bones, the mandible. We'll go over the mandible here in a little bit whenever we talk about some of the landmarks. Looking under here, there's that hard palate area I talked about on the maxilla. Right under it is the left and right palatine bones. It's that pink area right here. The palatine bones are their own separate facial bones. So don't mix those up with the hard palate, even though the names are similar. The hard palate is part of the maxillary bones, and the left and right palatine bones are right below the hard palate, but they're their own separate facial bones right here. There's that vomer one more time. It's orange. That's the little tip of the vomer. The vomer is right above the palatine bones and the hard palate. That vomer. It's a tiny little bone that's sandwiched in the middle there. Okay. So talking about the left and right maxillary bones, some of the landmarks I want you guys to remember. Of course, we have the anterior nasal spine, which is located right here. It's a little point right under the nostrils. That's your anterior nasal spine. If I go a little bit below, we're going to have what's called the acanthion. If you can see that. There's the anterior nasal spine, it's a point, and right below the point is the acanthion. Now the acanthion is very important once again because that's a major landmark we got to know for our positioning and central ray exit. Looking at it from the front, here's that anterior nasal spine, it's a little point. Right below it is the acanthion, right here. Then of course we need to remember, with all of our teeth, we have an alveolar process above each tooth. It's an actual little pointy part of the bone that actually protrudes, and you can feel it through your own gums as well. But that would be our alveolar processes of the maxillary bones. Don't mix that up with the alveolar processes of the mandible, because the mandible does have its own separate alveolar processes as well. So alveolar processes, or process, singular, of the maxillary bone, and then we have them on the mandible as well. But make sure you specify between the two, depending on what we're pointing at. Now just taking a closer look at the zygomatic bones, if you remember, the zygomatic bones are key because they form half of that zygomatic arch, which you can see very nicely there. There's your whole zygomatic arch. It's formed by the temporal bone and the zygomatic bone together. So if I was pointing to this portion of the zygomatic arch, you would say zygomatic arch of the zygomatic bone. If I was pointing to this portion, you would say the zygomatic arch of the temporal bone. Make sure you can distinguish between the two. And just remember, guys, that the zygomatic bone can go by three names. You can use any one you want. You can say zygomatic bone, zygoma, or malar. Whichever word's easiest for you to remember, stick with that. Now let us take a closer look at the mandible. I have a mandible here removed from the face, from the skull. We're going to go over some of the major landmarks I want you to remember. Now if this mandible, I'm not sure this will connect on here. Pretty good, pretty good. Here's what it's going to look like on the face. We're going to start from the most posterior portion here. This point right here is what we call the mandibular condyle. You'll see it go by the name of mandibular condyle or condyloid process. Either name is correct. You can use either name. If I remove this from the face, we can see it a little closer. This is that mandibular condyle or condyloid process. And that's important because this process will fit up into the temporal bone to form the TMJ joint. That's what opens and closes when we're moving our mouth. TMJ joint, which stands for temporomandibular joint. That's a major joint. You want to make sure you put a star on, remember, because you're going to see that again. So that mandibular condyle or condyloid process helps to form the temporomandibular joint. If we move down, we have a dipping down area, which we call the mandibular notch. Moving up, we have another process called the coronoid process. And if you remember, we also have a coronoid process in our elbow. Don't mix those up. We have a coronoid process on the mandible as well. Moving down, we have this long portion of the mandible here, which is called the ramus, or together the mandibular rami. That's the long portion going vertical on our mandible. We're talking about the portion going horizontally. That's the body of our mandible. If I talk about the point, and you can palpate this on your face, the point right here is the gonion. Or sometimes you can see it called the mandibular angle as well, but I would prefer you use the word gonion. That's the more accurate wording. You have two gonions, of course, and we use that for palpation and positioning of the skull as well. The tip of the chin is what we call the mentum or mental point. You'll see it referred to as well sometimes. If I move up, and we can't see this on x-rays, but on a diagram it's a little more observable, we have the the symphysis of the mandible. But the main one I want you to remember is the mental point, also called the mentum. That's the tip of your chin. And then right here we have a small hole called the mental foramen. That's the only foramen on that mandible that you need to be aware of. It's the only one that it actually has. That's your mental foramen. So the mandible has quite a few bit of anatomy to remember. All are very important. Make sure you study that mandibular anatomy quite well. That's something we can see. That's some anatomy we can see very well in our x-rays. You want to really focus on that mandible, just like with that sphenoid bone. When we're talking about orbits, when we talk about the base of the orbit, it is composed of 3 major bones, 2 cranial, 1 facial. The base of the orbit is composed of the frontal bone, the zygoma, and the maxilla. And let me reword that. I'm sorry. It's 1 cranial bone and 2 facial bones. Frontal bone, zygoma, maxilla. Those are the 3 bones that are forming what we call the base of the orbit. The frontal bone is going to make up the majority of the superior wall of the orbit. When I say superior wall, I'm talking about this top portion of the orbit, while the zygoma is going to make up the major portion of the lateral wall of the orbit. It's the most lateral portion of that orbit. So zygoma makes up the majority of the lateral wall of the orbit. Talk about the orbit as a whole. We're going to just talk about all the bones that make up that orbit. We have 3 cranial bones. That's going to be the ethmoid, which is the yellow portion back here, the frontal, the sphenoid, which is the red portion, and that's the 3 cranial bones that make up the entirety of our orbit. It's also made up of 4 facial bones, the lacrimal, which is this orange bone right here, the maxillary, which is the purple bone, the palatine, which we can't see very well on this model, but the palatine is a little tiny pink portion through that orbit, which you can barely see. It's going to be way back here. And finally, the zygomatic bone, which also goes by the name malar or zygoma. In total, that is 7 bones that make up the composition of the orbit. You do want to memorize and know all 7 of those bones making up the orbit. We also have a few openings in the back. We have the optic foramen, which is a little hard to see. It's that little round hole in the very back, the optic foramen, and that's important because that's where our optic nerve passes through to connect to our brain, followed by the superior orbital fissure and the inferior orbital fissure. But the main one I want you to focus on is that optic foramen, because that's one of the most major connection points of our eyes to our brain. Focus in on that piece of anatomy. And finally, guys, even though we can't view sinuses on a model, I'm going to show you approximately where they would be located on the skull. Your frontal sinuses are going to be about right here, and where the frontal sinuses can go in pairs or beyond that. Sometimes you can have up to 5 frontal sinuses. Behind here is going to be where our ethmoid sinuses are located, and there's also a lot of ethmoid sinuses. Below, straight through here is where our sphenoid sinus would be. And then left and right here is where our maxillary sinuses would be. All behind these bones, of course, is where those sinuses would be located. Definitely focus on your sinuses, even though we can't see them on models. Look at them on the x-rays, because once again, sinuses are important because we make that a mandatory exam on your capstones, and we do see sinus x-rays more often than anything else on head work. You'll probably see a lot of those come in, especially this time of year when people's allergies are really messed up. So definitely zero in on those sinuses and how to identify them on radiographs. Okay, everybody, that's going to do it for this tutorial. I do hope it's helpful and gives you a little more insight to some of the landmarks I want you to focus on. And maybe it's just a new view instead of just looking at it on a 2D image on your PowerPoints. But study hard, memorize, guys. And as always, if you need any more help, please don't hesitate to let me know. Have an awesome weekend, and I will see you guys soon. Bye-bye.